is addiction? Addiction is defined as a chronic brain disease that is manifested by compulsive substance use, despite harmful consequence. There are many different types of addiction. Addictions to drugs, alcohol, food, sugar, sex, shopping, gambling, and even the internet. In this video, we will describe how heroin addiction works, but essentially, addiction works by overstimulating the pleasure circuits of the brain, making the brain want more of that feeling the next time. Heroin's method is imitating the structure of endorphin. After heroin is injected into the body, it travels to the brain, where it can bind to the neurotransmitters that are meant for endorphin. This causes an artificial high that is much stronger than a natural endorphin would cause. There are a few heroin addiction drug treatments already available. However, a lab in the Scripps Research Institute under Dr. Kim Janda is trying a different approach. They are developing a sort of vaccine for heroin. The vaccine prevents the user from being able to experience the high, as if no heroin was injected at all. The vaccine works by causing your body to produce antibodies that recognize heroin molecules as foreign objects. The next time heroin is used, these antibodies bind to the heroin molecules. Because the immune system is generally not permitted to cross the blood-brain barrier, the heroin never reaches the brain and causes the high. Let's hear from Paul Bremer, a research associate in the Janda lab who's working on this vaccine.
So naloxone and naltrexone, they're small molecule drugs, and they will bind to receptors in your brain, block the drug from getting there, but they have significant side effects that are associated with that. Obviously, the vaccine will not even cross the blood-brain barrier. The antibodies just stay in your blood.
So far, the lab has done tests on mice and is currently working with monkeys.
There's a lot more involved to get into humans, but that's the eventual goal.
The tests look promising.
We have not seen any side effects of any kind in monkeys or mice. We monitor their health all the time, constantly, and we didn't find any sort of side effects, body weight loss or injection site reactions. I think some of the most common side effects you get from your typical flu vaccine, you get some kind of injection site reaction, maybe like pain and tenderness where you were injected. Side effect of the immune response, localizing to that area. We didn't really see any of that.
A patient would likely need 3 injections, each spaced a month apart, to build enough antibodies to protect against a potential heroin high. One of the original intentions for the use of the vaccine is in third world countries, where needle sharing causes huge problems, especially with regards to the spread of HIV. Because of this, and cheap cost of producing the vaccine, there were few investors in the beginning. However, there seems to be promise.
What it's really going to take is a lot more funding for the clinical trials, because we're just dealing with the preclinical aspects. And we're not, clinicians either, so we're going to need not only more funding for the clinical trials, but we're also going to need to partner with some clinicians. But we want to optimize all the vaccine components as best we can before even considering going into the clinic. We do have some interest from some companies and some entrepreneurs who want to invest in this sort of thing and want to fund those kinds of things, but we're kind of at an early stage here in getting those investors on board. I think now, and it's very recent, even just, 1 year ago we were, struggling to find funding, but it's actually looking better now. It just takes time to get attention. It's not like, your traditional type of small molecule drug. They're pretty standard methods for designing those and, performing clinical trials with those small molecule drugs. But this vaccine's kind of different. It'll take a little bit of trial and error to figure it out.
The vaccine would be particularly useful for people who have stopped heroin use and want to prevent relapse. There are currently several other methods that are used to treat addiction. Addiction can affect people in many different places. Here at Stanford University, we have a resource called Peer Health Educators, also called FEES. They live in our dorms and are available to help us at any time. I live in Rinconada and Wilbur Hall, Let's go meet mine.
I'm Lillian Meekum, and I'm the FEE in RINC, and that stands for Peer Health Educator. So essentially, the FEE's role is to support the health and well-being, as we say, of the residents in RINC. So that can range from mental health to physical to emotional, sexual, pretty much anything on the spectrum. I think I would refer them to a specialist at Vaden, perhaps some counseling at CAPS first, just because the CAPS counselors see a lot of students every year who come through with a variety of things that they want to talk about, and addiction is so much more than just a physical illness. I would say there's a lot of mental and emotional stigma around it as well, so I think a counselor would be really helpful. There are a lot of national hotlines that I used to work with non-Stanford, students. I used to work at a clinic just off campus through a Stanford organization, but we saw non-Stanford patients, and sometimes we saw people come through with addictions.
There are many resources available online that can be found by a simple Google search. A big thank you to Paul Bremer and Lillian Meekum for agreeing to be interviewed.